Now, there are two things that you're able to see on my screen. One is obviously I've opened up the spec sheet that we'll be following as you know that when we do the coverage of the unit. So what we're going to do is basically start off with the learning outcome 2, and I've sent you, a bit of an email with the the slides in terms of the presentation, and also a small handout, which is predominantly from the NHS website, and it talks about basically the strategy which NHS is going to be adopting for the next 5 years in order to look at reviewing change and how factors affecting change help obviously provide better patient care or better care from the National Health Service. Now, just following up let's do a quick recap in terms of what we covered in Learning Outcome 1. I think in Learning Outcome 1, what we initially looked at was we did look at some of the key factors which are driving change in the health and social care sector. And here, what we understood when we started the learning outcome was to understand the complexity of the sector in terms of what all features and services which the healthcare sector, in general, is responsible for. We looked at the broad functions, broad 4 areas through which some of these factors come from, and they affect the services which are being provided. So we looked at governance, we looked at the macro environment. We also looked at, to a certain extent, how individuals receive and behave when they get these services from the healthcare system in general. And then from the framework, what we looked at was how some of these factors, which were basically driving the change in terms of how we get services, reasons being that we are living longer, there are new obviously symptoms and diseases being discovered all the time. So there is a lot of investment which is going in within this sector, within the NHS, to provide, treatments for these, new illnesses which are being discovered. And one of the key things that we looked at was that because these things are driving the change within this particular sector to and affect the services which the individuals receive, what we did was we identified the 3 big drivers which kind of pose all the challenges way up to 2035, 2045 in the NHS plan. And we looked at basically the increase in population, longevity in terms of our living. We looked at the complexity of healthcare services which are required now to be provided in terms of not just the basic healthcare, but also looked at mental health services, and also the challenges which the workforce which works within the sector poses, because we have seen a lot of people who started to work within the sector, are aging in terms of their experience and obviously the work which they do within the sector. So what we need is now new impetus in terms of new types of, basically new people joining this healthcare workforce, which would mean that, this sector would then continue to provide these kind of services which are required by the individuals within a state like UK, which is a social and a welfare state. Now, leading on to, we did some study about some of the factors which basically affect, these challenges. And then leading on to now, what we're going to be looking at is basically learning outcome 2. And in the learning outcome 2, what we are looking at basically is understanding how these changes are going to be affecting the health and social care. So what we did was we identified the changes or factors which are affecting health and social care. But here in learning outcome 2, we are looking at evaluating how these factors are going to be affecting health and social care. And in effect, with this, what we will also look at is understand how do we monitor and evaluate these changes within the sector. So towards the end of the slides, what I've done is we've got about a good number of slides to go through. There'll be some slides which are definitions and basics that we are just going to go quickly go through. But towards the end, what I've done is I've put some sort of a plan, which is a reference to an emerging country plan, which shows us how monitoring and evaluation can happen, within this, when we look at the changes and the challenges which are affecting health and social care. So what we need to be able to do is in the second part of the learning outcome 2, we need to be able to come up and understand how monitoring and evaluation as a process works within this sector. And then from that aspect, what we need to be able to do is kind of benchmark with regards to the frameworks which are then employed to measure the overall impact of these changes which are happening in health and social care. So let's start with the basics of understanding, the process of monitoring and evaluation first, and then we will correlate it to some of the examples to understand how these changes are impacting this sector in particular. Now, monitoring and evaluation, in short, M&E, will basically be a process that we will go through to understand what are the essential tools and techniques which are required to implement all the activities within this sector, within the healthcare sector. Now, monitoring is essentially an exercise when we look at basically a process wherein we are continuously looking at measuring and evaluating predominantly certain activities which are happening within this sector. Now, the reason why monitoring is done to a certain extent is because we want to be able to identify from a point of view of quality purposes, if the processes and policies defined to provide healthcare to individuals and patients in the UK, for example, are working and are giving the outcomes as per plan. And the other would be to identify gap areas that we would want to do monitoring for. So, and the third bit would be when you identify gap areas, what we are looking at doing is we are also looking at taking corrective actions to correct or fill those gap areas. So to give you an example, when we look at the context of say let's look at educational activities, what we tend to do is we look at doing continuous inspections because you want the delivery of teaching and learning to be consistent in line with the defined policies which the government or say for example Office of Qualification here has laid down. Now, if they do find during inspections, which is a process of monitoring, that there are gap areas or there are areas in which there are slippages on standards, then what the monitoring agencies typically do is they put together some sort of a plan, which they basically make some recommendations, and on the basis of that, what you do is you put together some sort of a plan to be able to cover those gap areas up. So similarly, in the healthcare sector, what we're looking at is there are monitoring agencies like the CQC, which is Quality Care Commission, and their role is predominantly to look at, ensuring that since the Act, Social and Healthcare Act, which was created in 2014, the way it is supposed to work in terms of people receiving the care and support, which is designed to be provided as per the Act, is actually done by the providers which provide these services. Now, the second part of the process that we look at is when we look at evaluation. Here, what we are looking at doing is we are trying to benchmark against desired results or standards which have been set in the Care Act of 2014. That yes, the patients are able to receive those services. So here it is more of looking at benchmarking against standards which have been set in the quality manual, for example, and how these services are being delivered, and if they are being delivered, are they achieving the set objectives under the Care Act of 2014 is what we want to be able to look at when we look at evaluation. If there are gap areas identified and these are systematic gap areas, then in those cases what we have to do is we have to redesign and re-engineer the processes to be able to meet the requirements of services which are required to be provided as per the Care Act of 2014. Now, the other thing that we look at is how do we define monitoring? A general definition of monitoring here would be a process of measuring, recording, collecting, and analyzing data on actual implementation of program. So if you imagine within the healthcare context, if we have a new machinery or a new equipment being introduced, say a new MRI scanner being introduced, now the only way that we can actually see that the new equipment is better in terms of its performance or providing results as against the previous one which was being used, if and only if we do a pilot phase in terms of running a trial, or in other words, what we look at doing is we do a bit of monitoring to see if it is recording, measuring, collecting, and analyzing data as per the standards required when we are bringing this new equipment in for implementation or for the usage within the say for example within the hospital. So monitoring, when we look at generally in terms of definition, consists of 4 or 5 broad activities. One is measuring. You're looking at recording and collecting the data. And then at some stage when the measuring, recording and collecting of data has been done, what we do is we looked at analyzing it to be able to then work out whether it is working in line with the standard set for it to achieve its objectives. Now, in terms of why monitoring is done, it is done because we want to be able to understand how normals or benchmarks can be set. And once the benchmark is set, how those benchmarks can be upped or can be improved further is the reason why monitoring is done. Sometimes you will see that we do also monitoring because we have to compare previous performance or standards with the newer standards or benchmarks being set. So when we look at the wait times in A&E, for example, what we do see is that there's a set government target that they want to reduce A&E times from an average of 2 hours, 48 minutes in certain areas within England down to less than half an hour from the time the patient arrives in A&E and a handover happens to the the medical doctor within the hospital. So sometimes you will see monitoring being done to look at performance levels, measuring or comparing of performance levels, and that could be from looking at previous levels to setting new benchmarks. And in those cases, what you also are able to do is able to calculate deviations or variances which are occurring because of the monitoring process. So sometimes when you monitor, simple example would be you monitor your blood pressure, and then what you do is you monitor your blood pressure maybe in the evening, or you monitor blood sugar in the morning when you're fasting, and then you have measuring of your blood sugar happening when you had breakfast or a lunch. So what you're looking at doing is measuring the variance in terms of how much is the results of the test varying, and that can also be done using the process of monitoring. Now, one of the key activities which is related to monitoring that we will see again and again before we go to evaluation would be the fact that there's a lot of planning which is required to be done for the purpose of monitoring to happen. So it just does not mean that if you have to monitor a particular patient, you have to set up some equipment, set up the ward, or set up a particular environment or a place wherein the monitoring can happen. So there's a bit of planning which needs to happen before even monitoring can actually begin. So you have to define the standards, you have to define the procedure, the test conditions, and all of that which is supposed to help do monitoring is effectively nothing but planning. So planning is required to be able to effectively monitor any system or effectively monitor any process. That requires a process of planning. Now, just to summarize, what are the key areas of monitoring within the health and social care sector? So the key areas of monitoring within the health and social care sector is they want to detect deviations from plan. So when you look at locums happening, when you look at patient clinical treatments happening, what you want to be able to look at is what was the planned treatment and is there a deviation from the planned treatment? What are the diagnosing causes for deviations? So for example, if the treatment was supposed to finish in 4 weeks, but it took 6 weeks, what were the causes of those deviations? And then how they can be corrected so that when a next patient or a next cycle of those monitoring happens, you do not see those variances. So from a healthcare context, these are the 3 reasons why we look at the process of monitoring within the from a macro view or from a top level. Why do we look at the monitoring process? Now, in general, when you look at monitoring happening within the organization, you look at 3 different types of monitoring. One is monitoring happening from the top. So the CEO or the top management would be looking at doing monitoring. When we look at the practice manager, or for example, we look at a particular PCC trust, wherein you have a number of hospitals, what they will look at doing is the management would look at monitoring from the top level, and they would look at monitoring the basic major or the major milestones or objectives which are set to be able to achieve the full strategy. So if there's a budget which has been set, and in that budget some amount of care improvement plans have to be delivered, they look at monitoring that from a top level. At the middle level, the managers are more concerned when they are looking at the nitty-gritty of things in terms of making sure that most of the things which are required to change or things which basically kind of affect the output, or say, for example, in this case, the patient care, those are made available, and this is what the responsibility of the middle management is. An example here would be when you look at a bit of monitoring happening in terms of, say, an example, Tesco stores. There's a lot of pilferage which happens in all these large format retail stores. So one of the levels of monitoring which the general manager or the director of the store does is they want to minimize pilferage down to 0.5%. And their main aim is they cannot minimize or eliminate the pilferage altogether, which is theft happening on the floor or whatever it is. They want to bring it down to a certain percentage of the overall turnover of that store. At the middle management level, the manager is more concerned in finding out where the pilferage is happening, why is it happening, and are there enough deliverables available to avoid that theft or that pilferage happening within that store. And then you will see the managers at the operational level, people who are dealing on the front end, at the tills or maybe within the aisles when they are working, they are looking at supervising or essentially finding out what are the specific areas or the activities wherein they find, this kind of, theft, pilferage, or, excessive usage happening. So, for example, what you get to see is a lot of people go into the stores, they'll pick out a drink, they'll have the drink. By the time they go up to the tills, leave the store, they would have dropped that, empty can of the drink into the bin. Now, that is a loss of stock for the store. So managers at the operational level are wanting to understand which particular aisles is where they will see more of this happening. And they have to be then vigilant and have activities planned in and around that area, which tries to reduce this particular, pilferage or theft happening. So there are different levels of monitoring which also happen within the health and social care context. So when you look at a consultant coming in to visit the patient, you look at the medical doctor looking at the patient, and you look at the nurse looking at the patients and providing the basic care, the basic tests happening. This then gives you an idea in terms of the different levels of monitoring happening even within this particular sector. Now, one of the key things that we want to be able to look at is when you understand the CARE Act, 2014, what we want to see is that the CARE Act has to be consistently applied, and you need to apply it so that it provides the basic care services which are to be received by people who are eligible to receive the care and support, in a, say, for example, a particular council or a local authority. So here, what the council would basically do is they will have to look at the rights, of the carers vis-a-vis the care that they provide when they, look at providing it to the people who are eligible to get the care and support because of maybe a disability or because of whatever reasons. Say, for example, because of, a particular illness or an accident or whatever, or in this case, from a point of view of long-term illness. Now, the council is required to set the budgets which will allow care workers to go in and provide that care to the people who are eligible to get care. And then if there is any gap in the funding, has to be evaluated from a point of view of making sure that it is provided to those people first who are in absolute dire need of getting that care first. And here is where we look at the process of evaluation coming in from that example. So evaluation is nothing but it's a systematic way of learning from experience and using the lessons learned. So I think sometimes we do get to see lessons have been learned. You get to hear that phrase quite often on the news, that lessons have to be learned. So evaluation is nothing but a process wherein you are going to be learning from experiences, learning from past experiences of how to improve the current standards so that there could be effective planning which can be done to provide better care from a point of view of better care to the patient from a point of view of the health and care sector. Now, there are lots of reasons of looking at evaluation. Now, one of the clear reasons why we look at evaluation is that evaluation, like we looked at monitoring, there were lots of reasons to look at monitoring. Is we wanted to measure performance, we wanted to look at a comparative in terms of sometimes when you look at performance, and also to measure deviations. So why do we look at evaluation? Now, evaluation is looked at primarily because we want to see whether the services which are planned are implemented as per the goals and objectives and are able to meet the standards or not. So you need to be able to evaluate that this is something that I needed to do and was I able to do it in this time. Now, if you do not evaluate, you will never know whether your performance or the time you took to do that activity was something which was adequate, you took more time or you took less time. So evaluation is done to review implementation. That's the first point. The second is we want to be able to develop a progressive, some sort of a chart to see if there's a progress being made at every step of the way. So when you put a corrective action plan in place, what we do get to see is unless you evaluate that plan or why these corrective actions are being taken, there is no way that you can ascertain that there is progress being made steadily to cover those gap areas. So a corrective action plan requires for its implementation at some stage an evaluation to see if that gap has been addressed or not. Evaluation also helps in contributing to better healthcare planning. Okay, and then planning being essential part of monitoring. Planning is also going to be an essential part of evaluation because you would need to know where the start and finish is to be able to actually evaluate and go in and evaluate and do and find out whether this is working or not. And sometimes when you look at budgets, when this is not sometimes, I think this is one of the key factors when you look at budgeting within the NHS and when you look at the budget of the health and social care sector, it is roughly 1/6 or 1/7 of our GDP. So a lot of evaluation has to take place because a lot of this is funded by the government and it's coming across from taxpayers' money. So a good way of understanding if the budgeting has resulted in adequate results in terms of the aims and objectives can only be done if there is an evaluation as a process done to see whether this was just achieved or this was not achieved. So sometimes an example here would be that the government comes up and during the winters they do a campaign on flu jabs. So the reason why they do is if you're under 7 or over 60, you're prone to getting the flu virus. Now the government does spend a lot of money in this context to ensure that people who are vulnerable to or susceptible to cold and infections through cold should be able to get the flu jab more easily, and that is what they facilitate GP surgeries to hospitals and even through pharmacies. Now, in order to ensure if this spend which is being done on the marketing promotion or in terms of the actual administration of the the flu jab being provided to the patients is really resulting in the number of appointments at the surgeries going down, number of appointments at the A&E going down because of cold and flu or because of this flu virus, they need to carry out evaluation studies which will show that yes, because the plan was implemented well and this plan was implemented on time, so many people had the accessibility to the flu jab, and because of which they did not get hold of the virus in this year versus the last year, shows a plan of evaluation. So which shows that the funding which was put in place or the project which was put in place with proper planning did its job, and that can only be effectively found out by monitoring and to a certain extent evaluation, because you go in and try and find out what results were and were the programs able to achieve the desired outcome or not. Now, in order to look at the three of key reasons of why we look at evaluation is because in the health and social care sector, what tends to happen is new drugs are coming out, new illnesses are coming out. So there has to be a proper channel of evaluation to see if this is leading to, say, for example, betterment in terms of care being provided to the patient. So in order to improve health programs and infrastructure, there is an evaluation done by the government and by the Department of Health every 3 years, and this is done primarily to find out if these services are improving, and if they are improving, are they able to meet the aims and objectives, and that can only be done through the process of evaluation. The second part is when you look at allocation of a lot of resources. Now, this particular sector has about one of the largest employees within the public sector. So about between doctors, nurses, and the ancillary staff, there are 155,000 people which works within this sector. So a lot of expensive resources are allocated, and in order to ensure that these resources provide, both in terms of people, infrastructure, equipment and other resources, provide the relevant type of care required within this setup, you have to look at the process of evaluation and how to better improve, look at savings wherever possible, and wherever savings can be achieved, efficiencies can be achieved, have to be looked at through the process of evaluation. And last but not the least, when we look at activities which are being done within this sector, there are lots of activities happening and lots of different types of things happening within this sector. In order to ensure that each activity is having a cause and effect and is leading to providing better patient care, you have to do the process of evaluation. So monitoring and evaluation are critical aspects within the health and social care sector, because they help the government and the healthcare department to clearly identify the changes which are required to be done within this sector on a continuous basis. Now let's look at an example of how M&E, or monitoring and evaluation, as an example, has been carried out in the RCH program, which is Reproductive and Child Healthcare Program. Now this is an example that I've taken from a health emerging economy like India, wherein they have put the process of M&E and the framework of monitoring and evaluation to bring out and measure the overall impact of changes which the program is bringing into in terms of this sector. So they launched this program in 2005, slightly older example, but the idea was they wanted to look at minimizing the fatalities which are happening specifically within the RCH program in a particular state in India. So the Department of Health had created some sort of a vision document, and that vision document basically said that they want to look at minimizing deaths happening or fatalities happening within this particular sector, to bring it down to a very low level, and that was set out in this program in terms of vision of 2020. So what they wanted to ensure was that the sector had to be upgraded in terms of its facilities, in terms of equipment, in terms of response teams. And by 2020, they wanted to see that this particular department should be self-sufficient. And in order to make that happen, what they've done is, what they did was they created this program wherein now at every 5-year period, they were looking at evaluating it to see and course correcting the program to see if it was leading to the results required in reducing the number of fatalities. So in this table, what they look at is they look at the first phase of 2002 to 2007, and then they look at the second phase, and they look at the third phase, and then they look at the final phase. Now, what they're looking at tracking in this is, when they look at monitoring, is that the population is growing, the infant mortality rate is what they want to bring down. Under 5s, they want to reduce, and they want to totally eliminate. They don't want any fatality to happen, in terms of under 5, in terms of age group of children. And then, in terms of the fertility rates, they want to increase. Say, for example, when you look at the case of miscarriages and things like that, they want to reduce that to 0 by 2015 and beyond. So this particular program, when it was implemented, there's an action plan which has been created. Some of the key indicators for the program have been put out. And then what are the quality indicators which are going to require investment, both in terms of manpower, infrastructure, and the trained manpower were put into place here. These are the basic minimum quality indicators that they will monitor. And then what is the impact of those quality indicators on the overall impact of the program objective, which is to reduce the fatalities happening in reproductive and child healthcare. Child healthcare in particular, under 5, is what is mentioned here. And then what they did was they've done a course correction on this plan by looking at measuring basic, phase 1, And after the phase 1, they found that there were some gap areas, and these gap areas, in order for them to be corrected, they created what you call a action plan, which has been described on this slide. And then how the monitoring and evaluation of that action plan is being done is then subsequently summarized in the subsequent slide. So here what we are looking at is the variables, which are 5, which is the growth of population. We were looking at the infant mortality rate. We were looking at under 5 mortality rate, and we were looking at the fertility rates. So when we look at that as an option, these 5 variables, when we look at on these 5 variables with the basic factors in terms of assumption, the parameters which were required, and then the quality indicators were then monitored and evaluated to see if the program is having an effective outcome, which is set as per the goal, when or the target set as per the program when the program was initiated. And that is where, we look at the whole cycle of understanding where the monitoring and evaluation fits. So these slides, when you look at these slides, these are an example. You might not want to go into the nitty-gritty of these slides, but essentially we want to know that there's a program which they've started wherein they want to reduce the mortality and infant fertility rates in order to reduce the mortality for under 5 and under specifically with the aging and growing population. How they put an action plan in place, what were the indicators, but coming to the basics of how the framework is then applied. So when we look at the framework being applied here, they are looking at understanding what changes are happening because of which this program requires to be implemented. So changes happening were the tremendous growth in population, the reduction in fertility rates, a lot of miscarriages happening, and what were the reasons behind which this is happening, leading to fatalities in terms of birth. So the monitoring and evaluation cycle then was put into place with this program. And in this program, what it does is it looks at a 4-step process of identifying the problems. Once the problem and the cause of the problem is identified, what they do is they basically look at setting some goals and objectives of how to improve the cause and analysis, of the problem. And once that is done, the plan is then put into place, into implementation. And once the implementation starts with the augmentation of, say, resources, trained workforce, awareness campaigns, making sure the right drugs and delivery is available in order to reduce fatalities, then they put some sort of a monitoring and evaluation in place to see if these investments, changes, augmentation of workforce is actually leading to reduction in fatalities or not. So this goes on and talks about slightly, I would put it this way, the process of monitoring and evaluation in a bit more detail. And this bit, when we look at is defined in some of these slides, just to make sure that the elements of what are the key differences between evaluation and monitoring are made clear, and how they are different from how they are 2 different processes which can be utilized to identify the factors which affect this particular sector. So a couple of slides which are going through that, and towards the end there is something which is talking about an evaluation matrix, which basically gives you a snapshot in terms of how some of these changes can be proactive, or some of these changes can be prospective or retrospective. So that means some of these changes can be introduced considering the assumptions or the background information that we have in place, and sometimes some of these changes are actually put into place because we know the results of previous exercises which have been done in order to improve patient care. Now these slides, specifically from slide 29 onwards, they basically talk about what are the changes which are happening in health and social care within the UK context, and then what are we looking at, what is the NHS actually doing to ensure that these changes are appropriate and are able to provide the care and the services required by patients within within England and in particular in the UK. Now, so these are a couple of slides which I've taken from the NHS, 5-year review, which was presented, I think, in 2014. And there are some references that I put towards the end of the slide, and they talk about the 4 core values on which NHS is going to be looking at, providing these services. They look at clinical engagement, which are procedures happening within the hospital. After the procedures happen, what they look at is in terms of patient care or patient involvement, which is to do with, once the procedure has taken place. Then they look at handing over to the local community so that there is a postnatal care, or, for example, if you had a baby, you need maternity care, which is even beyond the remits when you get discharged from the hospital, and, there is care provided at home. You say, for example, via triage teams and things like that, visits happening to your house from the nurses to check on the care of, the health of the baby and obviously the mother. And to a certain extent, the 4th pillar, which being the national support. That means, you're looking at facilities or infrastructure like hospitals, surgeries, and equipment and other bits and pieces which are made available to run this whole, care program. Now, some of these slides basically then go into a bit more detail in terms of why do they look at, these 4 pillars and what they essentially do. And then I'm going to go on to this particular slide, which basically talks about, the 8 enablers which will overall, impact how health and social care services are now provided from the NHS within the UK. So the focus is on currently looking at designing new healthcare models, which basically have involvement at the local, national level, and there is a coherent, synergy in terms of working closely together, both at the local level and the national level. That means you look at a lot of trusts which are there within the NHS. So one trust should be able to speak and get services from the other trust if required. How the evaluation and metrics, which is basically evaluation and monitoring, is adapting with the changing requirements within the health and social care sector. How the integrated commissioning and provisioning is happening. That means the public-private partnerships which are happening, wherein there's an integrated working closer between the two to be able to deliver some of these services. How some of these services are being empowered within the local communities. Technology, which is a key leveler in terms of making these services now available, because patient records are all available electronically. Some of these things do allow, technology allows some of these things to be, better facilitated. Workforce redesign, that means key requirement of the healthcare department, or key requirement of this particular sector, is that there needs to be an influx of new professionals coming into this profession to be able to provide these services. How can the local delivery, be coordinated with, say, for example, some of the other areas which require peripheral support. So when you look at substance misuse, for example, addicts, they do not get all the treatment within the hospital, but the treatment of those happens within the local communities and also in other areas. So that kind of thing. And last but not the least, one of the key things which have been identified as one of the enablers is the awareness, the availability of information, and the engagement which is required with the patients now to be able to administer and effectively deliver these services to individuals who require it. Now, some of these slides basically talk about these 8 enablers in a bit more detail. So I'm not going to go through some of them in the session today, but just very briefly, some of these, there are 1 or 2 points which are picked up, and those are ones that kind of give you some more detail in terms of how these are enablers and why they have been identified as, enablers in particular for making sure that the services are delivered, and these changes or these particular 8 factors which have been identified will better enable the delivery of these services within the UK in the years to come. So These 8 factors, explained in a bit more detail on these 8 slides, kind of brings us to a bit of conclusion in terms of looking at the learning outcome too. So just to summarize, I think what we are looking at in this particular outcome is the key factors that we've identified, in learning outcome 1, which are driving change and are contributing to driving change within the sector. In the learning outcome 2, we are looking at understanding how the CARE Act, requires consistent monitoring and evaluation, and what are the key changes which are happening, which require this monitoring and evaluation to ensure that the overall impact of these services being provided by the NHS and the healthcare sector in general are then appropriate for the patients who are receiving it. And one of the key things that we have to understand is, I think, the CARE Act of 2014, which kind of revolves, and which is one of the reasons why why this came out, was that we need to, the government really felt that we need to have kind of defines this, basically defines this from a point of view, the CARE Act basically defines, sets the standards and also defines the standard to a certain extent. And the reason why monitoring and evaluation is required on a continuous basis to be able to ensure that, the services are then provided to the patients and to the people in general, and they remain healthy and remain independent, and because we are living longer, they remain healthy and remain independent for longer. And that bit in terms of monitoring and evaluation, which has been set out in the Health and Social Care Act, the Social Care Act especially of 2014, requires the process of monitoring and evaluation now being done at various levels to provide these services. So I think the other handout which I basically provided, to better understand what we've discussed, I think what we've done is we've discussed basically an overview of the learning outcome, but the effect of understanding why this is required can be done when you read this particular handout, which I included, and parts of which I have actually included in the presentation, to understand the issues of how the changes, what are the changes happening, how these changes are, what are the factors which are bringing these changes, and how these changes are impacting the delivery of health and social care services within the NHS and within the UK in particular. So this is a handout which is quite an elaborate one, but at least gives you a perfect understanding in terms of how these things are happening within the sector. So I would say this is a bit of a reading that you need to do to be able to identify the framework of monitoring and evaluation within the health and social care sector, because we are really actually studying it within the context of health and social care. So this particular handout will be good for you to be able to read, understand the challenges, and what NHS is doing in order to address these challenges is actually explained also in this handout. Is that okay? Now, I would probably want to nod at this moment from you, Sadia, but I think keeping in mind your mic is not working, but to a certain extent, what I would want to know is that, yes, was it okay? Were you able to understand this?
I think just asking because my mic isn't working.
Okay, that's great. So that's a bit comforting, because I think I'm not able to hear you, but yeah, you're confirming that yes, okay, it is fine. Now, apart from this, what I'm going to do is try and send you something from the book which is pending, which I need to come back to you on. The 2 learning outcomes that we have covered in terms of an overview, I'm going to try and come back to you sometime tomorrow, drop you a quick email and also will upload a ebook that we have, not a generic one, but at least one of the ebooks which will actually cover these factors, the challenges, and how they are being addressed. So I'll mention this particular handout which I've shown you here is basically generic reading. This is to understand, because if you're going to be working within the sector, I think this is one of the strategic documents that you need to look at reading to be able to understand why this is being looked at, and why the 5-year study, and why the goal of 2045 and things like that. But from a point of view of the unit and the assignment, what I'm going to be able to do is come back to you to give you that ebook on the modal, and also maybe some pages for reading to be able to crystallize the the activities that you have to do for the assignment. Is that okay?
Yeah, can you hear me now?
Yeah, I can hear you now. Yeah. Okay, great.
Well, yeah, my husband just managed to fix it last minute.
Okay, that's great. That's great. Yeah, I can hear you well now. So basically, the book and the pages which is specific to covering the tasks and the assignment is what I'm going to come back to you on with regards to learning outcome 1 and 2.
Okay. Yeah, no,
Okay.
that's fine. Yeah, this was really good. I understood everything. If I have any more questions, I'll get back to you like I do.
That's absolutely fine. Just drop me a quick email. Sometimes I will take maybe a day or two to kind of go back to you, because the reason is we've had a number of students who have started a number of programs, and I was in the midst of doing some inductions, so which hopefully will end tomorrow in the morning. And I think then from then on, I think we'll be primarily kind of very regular on these sessions. So because I've sent the email to you already for the learning outcome 2 and 3, I'm not going to be sending you this email, but later by tomorrow send you an email with regards to the book and the pages that you need to read, which will help you do the assignment.
Yeah. Would you be sending this presentation as well?
This I've sent you already in the morning.
Oh, okay, yeah. That's
Yeah,
fine.
which is learning outcome 2. And I did also send you a few handouts. So there's a handout, which is this handout, which I've opened up earlier, that you have received, should have received at least. That is learning outcome 2. And then there's a learning outcome 3, which I've enclosed, the presentation.
Yeah.
And this presentation, again, will be focused on the fact that we are looking at change management in general to study as a theory and theoretical framework. But what we're going to do is contextualize it from a point of view of looking at health and social care when we do the next session. And what I've done is I've sent you 2 handouts in this. One of them talks about change management as a process, and why it is very important when we look at how it's evolved over the years, the 1930s, 40s, 50s, 70s, and post-90s. And then what I've done is I've also put together a handout which is very detailed. This is an extract essentially from a book, but we will cover this off by looking at how we will look at change management as a process within the health and social care sector.
Okay.
Okay.
I hope I'm not behind on my course or anything, because I'm still working on the first one yet. So...
Oh, you're absolutely okay on that. As I mentioned to you earlier, we don't mention, I don't think we'll put any deadlines to how and when you will submit assignments, but just as a general practice, as a good practice, what I've seen is we will normally encourage you to kind of submit a draft in some shape or form within the 2 weeks of we completing the overview with you on the unit.
Okay.
So, for example, we still have 1 session to go on this, and we'll hopefully cover that off next week. So I would suggest that, something by 7th or 10th of December, if you send us a draft for this, then I can give you, some feedback on it, whether you're on the right lines or not. And then you can keep working on it to finalize it, so that by the time we start the 2nd unit, after the coverage of the learning outcome 3, we'll send you invites for the 2nd unit, but you have about 2 weeks to be able to submit the draft.
Okay. And do we have any word limit?
There is no word limit, no.
Okay, that's fine.
In the assignments, there is no word limit. Technically speaking, I don't think you need to be writing, lots of it, but a roundabout benchmark that we expect at level 5 is about between 4,500 to 5,000 words. When you are able to articulate the concepts, show the theory, cover the theory off, show the application, and also quote an example.
Okay.
But it will depend on the command verbs that you're looking at. When you look at the assignment task, so if it's explain, describe, you're primarily just covering it theoretically. But if it comes to compare, contrast, analyze, assess, or evaluate, you're actually having to show not just the theoretical background, but also application and example.
Okay.
But that's something which I'll give you some sort of a guidance, and what I'm going to do is share maybe a sample extract of an assignment for you to have a look at in terms of how this is done. So tomorrow when I send you the email for the book pages, I'll send you a small extract of the example of an assignment for you to be able to look at how some of the learners who've achieved certification with us over the years have actually done it.
Yeah, I would just like to look at the layout and stuff and what is kind of appropriate.
That's absolutely fine. I think I'll send that over to you. This is something which is a sample which I've already got, and I'm going to try and send that over to you, tomorrow. Rather than sending you the full assignment, I'm going to try and send you some pages, some extracts, because I've had learners in the past which basically have done the assignments very elaborate. So they've had, there is no word limit which ATHE gives, neither do we give from our side. And this is not to discourage the learner from submitting a detailed piece of work. But what I want to do is I want to send you a sample extract, which is not a distinction work or not a pass work, but somewhere in the middle.
Okay.
Because these qualifications are not graded, just like in the university, pass, merit, and distinction. So either you've achieved or you've not achieved. So there is very little differentiation in terms of, you are able to achieve that unit, but you're writing words and examples and turning it into a thesis, which is probably not required at this stage. So the idea would be to try and send you something which is balanced, but also helps you understand the concept well, and you're able to comfortably achieve the assignment as well.
Okay.
Okay?
Yeah, that's fine.
Okay, good stuff, Sadia. Thank you so much for joining the session today, and hopefully you have a good weekend, and I'll catch up with you